think it's going to be, I mean, I think it's a good news, bad news sort of situation. I think, you're seeing a lot of a lot of research, clinical research going on. It's very important. In the next decade, I think there's going to be a transformation in the way in the treatments we have, and in the ability to manage some of these diseases that we have trouble managing. So I think there's whole new technologies, new approaches involving things like stem cells, like biologicals, all kinds of new technologies which will be introduced, and some of these I think will have new efficacy, new ability to treat diseases that we're having trouble treating now. But and this is going to be a big change, so that's the good news, because there's real hope there. There's real potential for better treatments. The difficulty is that all this will have to be studied. There's going to be a progressive increase in the need to do clinical research and the complexity of that clinical research. So all the issues and questions that we're discussing today are going to be there, and they're going to be probably even more challenging than they are right now. So I think we're going to see, we're going to have to deal with these issues. How are we going to manage the need, and how are we going to do this in the best way? And how are we going to do this in a way also that doesn't slow down the progress and unreasonably limit the ability of patients to potentially benefit from what may be proven to be better treatment. So it's going to be a challenge. I'm looking forward to it. I think we need dedicated, well-trained, knowledgeable people to help us do this, and I think we're going to have to work with, and this is an outstanding opportunity tonight to actually have a discussion with people that are interested. Some of them in the health care sector, some of them patients perhaps, because it's going to be a partnership. We're going to have to figure out how to do this, it's going to be a changing landscape.
Is there enough money for it?
There's never, well, I think it's going to be a challenge, actually, because, but I guess, I'm not sure how it's going to work out. It's
well, would you imagine that the demands, and we live in a society, I think it even came through here, is the idea of wanting more and faster and so much, I guess, the possibility of so much, but there's a limit, and money is part of it. And
that's right, and it's not just money that can fund some of the medical therapies, it's also infrastructure to allow us to move forward. The whole research process, just the process of oversight of research, the research ethics boards, as this increases. I mean, this is a struggle. We have, it wouldn't happen without tremendous dedication of volunteers. The people on the board are volunteers that are giving up a tremendous amount of time, struggling with difficult questions, and in some extent taking risk because they're making decisions that, there's a lot to ask people.